Once again, I'll start over, folks. Welcome to the our weekly update on COVID here in Daviess County. And when I get done with that, I'm going to introduce three very special guests. We're going to talk a little bit about how the pandemic has affected post-secondary education. But right now, as I was saying while I was muted, that Daviess County has the distinction, if you want to call it that, of being one of the three hotspot places in the state. Right now, we, along with Butler County and McCreary County, are the only three counties that have an infection rate of above 80 per 100,000. Now, there are a lot of reasons for that. I'm not going to get into it too much. Daviess County has the 7th largest population in the state, but we have one of the 3rd largest death from COVID rate, which is not anything that's fun. This today, the report talked about 90, I think it was 98 additional COVID cases in Daviess County, and that's good news from the standpoint that we have been in triple digits quite often. We seem to be starting to trend down. I know the state, when you talk about Daviess County having an 83.5 per 100,000 population infection rate, the state's is about half of that. It's down in the 40s, which is a good thing again. One of the reasons I think probably we have such an infection rate is we were very successful. Jailer Maglinger was very successful in preventing the infection of COVID into our jail system. Everybody else back in April and May, I mean, it was running rampant. That along with meat processing plants and nursing homes was a terrible problem throughout the state. But Jailer Maglinger, through all the precautions that they take, was able to keep it out of jail until December. We had an outbreak. We were able to contain it. And then we had another outbreak here the last week or so. So the jail has been adding to our numbers. We also have a regional recovery facility for substance abuse, and they have had an outbreak there. So they were very successful in keeping it out for the longest time. So we just, all we can do is do exactly how I started the show. I always start it with wearing this mask. That's one of the tools that we have that can help prevent the spread of COVID. I'm not going to get into whether it be a one-ply mask, two-ply, or wear double mask. That's for the CDC and all the doctors and everybody else to talk about. Social distancing is very important. I know when people come into my office, even though we both wear masks, we sit at least 10 feet apart. The washing your hands, do what your mama taught you when you were little bitty babies. Wash your hands and avoid large crowds. And we try to do all those things here. We try to set a good example. I think that most people appreciate that. So far in Daviess County, we have had 8,527 confirmed cases. 6,500 of those have recovered fully. We have currently 13 people in the hospital. Now, that brings me considerable joy because we have been having somewhere in the range of 30, 32 people in the hospital. And that's a predictor of folks having very serious complications with COVID and possibly losing them. And we've had 142 Daviess Countyans die as a result of COVID. So I want, if you would, just join me for a second and in a moment of silence to remember those folks, remember their families. They won't be here to celebrate us, the joy of coming out and us beating this pandemic, for just a second. Thank you. The good news also is that the state's positivity rate, that's the number of COVID tests that are positive versus the number of people that they've tested, it continues to fall. It was up in that 15% range. It's now down around 8.5%, and it continues to fall. That's excellent news. One of the things that continues to concern me here in Daviess County is if you take the number of cases that have been confirmed and subtract the recovered cases and the deaths, that leaves you the number of active cases. and we continue to be very high. We have approximately 1,885 active cases in this community. And my good friend from the health department, Clay Horton, talks about probably that you can multiply that by 4 or 5 times in this community. So if you feel bad, don't go to work. If you're running a fever, don't go to work. Don't put your co-workers into that position. Don't put your boss in the position of taking your temperature and telling you, nope, sorry, go back home. Because when you show those symptoms, you are actively spreading the disease. So lastly, I would tell you, just so that you know, and when I said we're a hot spot, we are, but if you look at the grad population, the Green River Area Development District population, Daviess County makes up about 46% of that population. 46% of the population means we ought to have about 46% of the cases if it's spread equally, and we're dead on. We are absolutely dead on that number. So while we are high right now, things have a way of averaging out. We were low when Union County and Webster County and Henderson County and my good friend Judge Johnson in Ohio County, when those folks were having some real issues. So it's kind of evened out. More vaccine has become available. I have not had an update from the governor this week, but from what I see, we got a 17% increase last week, and we're supposed to get another 5% increase over and above that. Our vaccinations of the elderly in nursing homes and assisted living is going well and just about completed. Those vaccines will become available for us. Last week, there were 4 mega sites, drive-through sites for vaccines announced. There were none here. Don't get discouraged. I'm in constant communication with my good friend Jim Gray, the Secretary of Transportation, and they are still looking for other sites. We have submitted several sites here in Daviess County. Hopefully one will be selected. If it's not, there will be one selected near us, and that, I think once they get those sites set up, then you're going to see the vaccinations going quite quickly. Just for your information, my wife and I, when the 1B became eligible, we signed up and we received our first shot. And while I know Scott and Father Larry and Tom would probably take issue with what I'm about to say, I don't think I'm any different than I was 4 weeks ago. And we're going to get the other shot tomorrow. So, 1C, there are some folks in that 1C category, meaning 60 and older, or with some extenuating medical conditions that have signed up and have been able to get it. More information will be rolling out for the next 2 months. I would encourage you to go to the state site, KY COVID 19.ky.gov. A wealth, more information than you ever would want to see there, and information about the vaccine. Jordan, do you have the other site that is specifically dedicated to vaccine? Just put it up for a minute. There we go. On the screen, it says, when can I get vaccinated? It gives you a way to go through there. It will tell you where. There you go. It asks you a lot of questions, and it will tell you where you stand. And if you have any questions, there's a phone number that you can call. I think it's an excellent site. I've gone through there. But anyway, that's good enough, Jordan. You can take that down. What was the zip code, or I'm sorry, I'm sitting here trying to remember what it was called. I'll get that for you. Or Jordan, vaccine.ky.gov. Vaccine.ky.gov. A wealth of information. I've talked too long. I wasn't the one that you wanted to hear from. I have with me today Scott Williams, the president of OCTC, Tom Mitzel, the president of the Kentucky Wesleyan College, and my own father, Larry Hostetter, from a president of Brescia College when I was there, Brescia University now. And we're going to talk to them about how has the pandemic affected post-secondary education. We have heard and seen all the fights and all the arguments about people going back to school, grade school, high school. Well, now these folks run institutions that deal with adults, deal with grown-ups. And I want to hear a little bit about it. I would say this, and I hope, correct me if I'm wrong, Father Larry or Tom. I think I just saw where Brescia College and Brescia University and Wesleyan College were named top institutions for online learning, if I'm not mistaken. Congratulations. I think that really is the way of the future. So guys, no disrespect. Father Larry, I'm going to you first. Tell me, how has COVID-19 changed Brescia University and the way they deliver education to their students? Father Larry, hey, you told me you're still on mute. Get off of mute.
That's the one thing that has changed considerably is that I have heard those words, hey, Father Larry, you're on mute. I bet thousands of times without exaggeration. So thank you, Judge, for inviting us here. Like any other industry or business or enterprise, higher education has pretty much been disrupted and turned upside down by the pandemic, as I'm sure my colleagues will affirm. And, I don't think it's changed us fundamentally in terms of what we do and our mission. Our mission remains unchanged. When the pandemic began, we said what we want to do is to continue to provide a top quality education with the least amount of disruption as possible and as safely as possible. So one of the most obvious ways that the institution has changed is in the delivery of courses. I think everybody does it just a little bit differently, but the way we ended up doing it is we are allowing all of our students to, our on-ground students, this really doesn't affect our online program at all because that's a separate unit here at our place, but our on-ground students have the ability to take a course either by going to the classroom, and the classrooms have been modified and we make sure that everybody is 6 feet apart, the professors are masked, the students are masked, there's cleaning afterwards, those kinds of things. But if a student prefers, they can also, each of those classes is also doing exactly what we're doing here. We have a Zoom connection. So students can participate by coming to class, by participating by Zoom. And then last semester, for very extreme cases, we also allowed students to watch the recording of the class if that was necessary. And our faculty too have that option if they have an underlying medical condition or something like that of teaching remotely. And so that's probably the biggest way that we've seen the change in course delivery. I decided I wanted to experience it firsthand myself last semester, so I taught a New Testament class. I had 36 students, and it was really, honestly, an experience. So I think I understand what the frustrations that some of our faculty were experiencing, but also some of the frustrations that our students were experiencing. And we were able to take that and make some changes for this semester. But I'll let my colleagues share what they're doing.
Tom, how has this affected your on-campus enrollment as opposed? We know you've got an excellent online courses that you give, excellent online courses. How has it affected your on-campus student population? All right, you're going to have to hit yep, there you go.
It is the catchphrase of the year. It will never go away.
It is.
When the governor asked for all the campuses to shut down last spring, we were extremely worried. Students go away, you are only talking to them through online or by phone or by technology. And although our students have grown up with ubiquitous technology, they've never had to use it in this particular sense. And so it's a brand new area for them. We were very concerned about whether they would trust the college to do residential teaching again. And that bothered us. So last spring, toward the end of the spring, we called every student. We got volunteers around campus. We called every student just to talk to them and see their feelings. We gratified to see that our enrollment in the fall of 2020 was the highest it's been in 6 years. Now they did come back to different rules and regulations, as Father Larry was discussing. You have to have 36 square feet of physical distancing per student in the classroom. You have to have one-way hallway. We had one-way hallways, one-way staircases. We removed most of our furniture in the public areas. And in what we thought was a great idea, we gave each student their own camping chair. They could carry it around with them, set it up, take it back. And we liked the idea much better than did they. So we, at the end of the semester, had a really frank, open discussion with the students on what worked and what did not. But we've been able to keep our residential and commuter enrollments, and what we are trying to do the same thing as what Father Larry was discussing, really trying to give the best educational experience possible while keeping them safe and healthy. And the classes are working. They're not great. What we're finding, a lot of the trouble is what happens out of the classroom. And I tell everybody, and my faculty sometimes get upset, that for a residential experience, classroom activities make up about 25% of your entire experience. The rest of that is what you get outside the classroom: athletics, academic clubs, social clubs, internships. And those are the types of things where we're having trouble determining what it is we can give the students while still keeping them safe. So it's an ongoing battle.
I think you're exactly right. A lot of the discussion I've heard on grade school and high school education was that the transmission rates while the kids are in school, it's a very full and structured thing for them to join, but you can't control what they do when they're outside of the classroom, when they're off campus. And a lot of the cases of COVID were being picked up at ball games, at parties, even from their own family members bringing it back. And really, they weren't seeing a lot of students testing positive for COVID, but what was happening, a lot of the teachers and a lot of the support staff, they can't function without those folks, were causing schools to close down. So, well, Scott, you're in a little different situation. I mean, OCTC teaches some formal education, but you do a lot of trades education, a lot of hands-on stuff. Tell me how you've been able, and I would guess that, although probably, I stepped up, put some goggles on and grabbed a hold of some, I don't know, some of these visual hand things and did some welding that was pretty realistic, pretty live. So tell me how you're delivering what you do so well for our community.
Certainly. Thank you, Judge. And thank you for having us. And, just like my colleagues, we're all doing similar things to keep our campus, our students and our staff and our community safe. So we're a little unique in the aspect that you just said, Judge, is that we do have a large component of skilled trades, whether that's in the allied health, the manufacturing, transportation, construction areas. So for us, we really had to balance that. We couldn't just convert everything to online or remote learning. So we had to figure out a way in which we could bring students to campus in order to continue that training. And so it has been a challenge because of as my colleagues have already said, you do have to have space requirements, obviously. Have to wear masks and so forth, the proper PPE and all those types of things. So, but we've been able to do that. And the way we've tackled that, Judge, is we have been able to essentially take the component, what we would traditionally call lecture or didactic, put that online, and they come to campus solely to do those hands-on types of activities and laboratories. What that's done then is we can spread them out. So the time they're on campus, we can make sure that we have the number of students in a lab working is as safe as we possibly can provide that. So we have been able to do that very successfully. So if you look at us, 60%, we're entirely commuter campus. We have no residential, but 60% of our courses have an on-campus component. And so we are seeing students that are coming to campus and been able to successfully complete that. We have not had to extend anything or make the semester longer. We've been able to keep that in the confines. In fact, I'm pleased to say that this last spring, we actually, even though we had the disruption of COVID-19, we still saw this last spring and in December an increase in those credential earners. So we're still seeing students complete their coursework and move on and help them get started on their career. So, that's worked very well for us. The other thing we've done, go ahead, Judge.
No, I'm sorry, go ahead.
Just one last thing mentioned that's kind of, I think, a little unique for us is we have really utilized some of the funding is available to us to have a healthy at work techs. And so we do, when you come on campus, you are checked, temperature checked, you are healthy screened. And so if you, as you mentioned earlier, if you're sick or not feeling well, we don't let you in. And so that has worked out quite well for us to keep our rates here on campus very, very low.
You know, I would say there's nothing better than an in-person lecture from a professor who knows how to make the class experience unique and inviting. But I also know that a lot of the classes that I took in biology and chemistry, I could do most of that learning from my textbook, but I couldn't set up my own biology lab or my own chemistry lab or my own physics lab. So that's why, and I was, one of my questions, and you got to it, are you testing your students? And I'm going to assume, as I see heads shaking, that you make those tests available. For the two folks that have on-campus students, did the kids stay around during the holidays? Did they go home? What, Father Larry, how did that affect Brescia? And before you say anything, unmute.
Thank you. Yes, nearly all of our students went home over the holidays. I think even if we wanted to, at that point, they were ready to be back with their families. Actually, that was pretty successful. It gave us an opportunity to kind of, deep clean everything, get ready for them to come back, give us a chance to kind of recalibrate for the spring semester. So we had a few of our international students that stuck around, and some of the international students went back to their native homes, and they're not able to come back right now because of restrictions in their own country, especially in the United Kingdom.
Okay. Tom, how about your faculty? Have you had any issues there? A lot of the like I said, grade school and high school folks had faculty issues. You experience it? Did anybody, specifically you, did you experience any of those issues?
We set up all of our courses to be able to run in a hybrid sense, so they could run online or in person. Right. And 30% of our faculty fall into categories where they did not feel comfortable coming to campus. So they are teaching entirely online. We did go from asynchronous to synchronous teaching based on what the students wanted. They wanted that time where you come in at a particular time and you get to see your professor on Zoom, so much like a regular classroom. And then in areas where we cannot have our professors on campus, we set up student supplemental instructors to just help answer some questions. They don't take place of the lecture by any means, but especially for a younger student just starting out in college, study skills are very different from high school to college. We wanted to make sure they had their support and that they could actually talk to somebody in person if needed.
Okay. Scott, you and I have often had this conversation, and I suspect it's the same for Father Larry and Tom, but we often see an increase in those folks who want to go back to school and get more education when unemployment is high. Have you noticed any of that?
To be honest with you, it's been contrary to that, Judge.
Okay.
It's, what we're actually seeing is that traditionally that's the model that's always held true, but COVID-19 has been we're seeing people are just so uncertain. They're not sure what the future lies. And so there's almost this sense of being deer in the headlight, just, I don't know what to do. And so we've actually experienced the opposite of that. And so especially just students that don't quite have a career in mind or kind of undecided. I think those tend to be. Those that know what they want to do, we've not seen a decline in certain programs where there's a great opportunity for jobs and so forth. So we're still seeing it from that component. But it's a good question. I'm glad you brought that up, because we're actually seeing for us a little bit, and it's a national trend for community colleges, to be honest with you. During COVID-19, we were we're fortunate in the fall not to see too much of a decline, but this spring we've been hit a little harder. So,
well, as I pose that question, I remember we've been fortunate around this area, and that we haven't seen we saw a spike in unemployment, but it kind of trended back down to where we were one of the leaders in the nation for having people at work, and COVID seemed to disproportionately affect those folks who didn't have the skills or weren't essentially skilled workers. And I don't mean to belittle anybody. All labor is worthy of our praises, but restaurant workers in particular were hit hard. The hospitality industry and travel industry in particularly were hit hard. But the trades, they stayed open and continued to work. Now our meat processing around here really took it on the chin at the very beginning, but they were able to, along with the help of the state and the help of our local health departments, were able to address that. Father, tell me, when I came to Brescia College, I didn't know what the word or the acronym FAFSA stood for. There wasn't that help, I don't think, for kids. We either had to get out and mow lawns and work after hours or on campus to earn money to pay our tuition. But I saw the other day where the FAFSA applications, or the seniors who are filling these applications out, there seems to be a huge decline in that. Is there any indication that's going to affect higher education here in the next year or so?
Yes, I think that's one of the things that we're all very concerned about is next year. I mean, this year has been difficult on a number of levels. We've all been impacted financially. Those of us who have a lot of non-traditional students, as Dr. Williams had indicated, we have seen a decline in that group because of the uncertainty, whereas the traditional population seems to be relatively stable this year. Now, next year, all of the enrollment folks are saying, again, this is a nationwide trend, or seems to be, that seniors have been very reluctant in inquiries, applications, and filling out the FAFSA forms. So we're all kind of putting together, specific efforts, plans, campaigns to try to get them to fill out the FAFSA form. We saw, other things we're doing is to make it a little bit easier, and this time is by admitting without having to do, an ACT test or an SAT test. We just started that. It was optional last year on a case-by-case basis, and we made it optional completely for next year. So I think next year is going to be rough. I think higher education is going to go through a very difficult period if we don't have additional help from the federal government and the state government. I think that's going to be critical in terms of any kind of stimulus package that might come out of from legislation or otherwise, for that very reason. Now, we're going to do everything we can to get students to fill out that FAFSA. We know how to do that. But the problem is they're not in school, and so often you reach out to those students through their guidance counselors at school, through college fairs at school. A lot of that isn't happening right now. So we don't have the opportunity to connect with them in that way. So we have to find other ways to connect with them. But I do know that once we made that the test optional policy, put that in place, our admitted number jumped very quickly. So there are some things we can do, but we're going to need help. I think that is without a doubt throughout higher ed. It will not surprise me to see schools go under as a result of the pandemic, as we have already seen, especially in the small private institutions.
Okay, so the ACT and SAT, I guess they still give the SAT because that was the predominant one here when I went to college, and when my son went. I have seen where all the colleges are toying with doing the things that you're talking about doing. So, Tom, let's go just another step from what Father Larry was talking about. First of all, I was going to ask, since there seems to be a lot of online learning, are there scholarships to help pay for those courses?
Yes, I think all three of us would say that we have scholarships for online courses. What we want is for everyone to get the best education they can. Right. And if that's a residential experience, that is what they want, then we try to give them that. If it's an online experience that they want, we try to give them that. But we always try to help financially where we're able. Right.
Well, I know that there are scholarship opportunities that go begging here in this community year after year after year. And we do everything that we can to encourage people to go online to explore those. I know that all three of you gentlemen in your financial assistance office or student affairs office let folks know, and they're not hard. It's not hard to apply, and really it's not hard to get. And lots of times it's amazing. You might have 3 scholarships to give and 1 student apply. And so it just, things go lacking. Unfortunately, that's all the time I have today. I've got 2 gentlemen sitting out here in the lobby that want to talk to me about wireless communications or Wi-Fi, and that's very important, as you folks understand and know in our community, particularly in the rural community. We're kind of jaded here in Owensboro. We've got a lot of options, but if you go 20 miles outside of Owensboro, there are folks who run into the same problems as we do, particularly primary and secondary kids. We have set up some hotspots, Wi-Fi hotspots at some of our volunteer fire stations to help, but it's kind of tough to go down and sit in the parking lot and try to take a class or do your homework. So I want to thank all of you for being on. Tom, I look forward to you and I sitting down and having a conversation. Scott, I look forward to you finishing up the course that we've been talking about for the last 5 years and getting that out there for the students. And Father Larry, Father Larry, as always, it's a pleasure. I like to say that I'm a product of 16 years of Catholic education in this community. And Bishop McRaith used to go, shh. I don't think he wanted me to tell anybody that. So, but anyway, thank you, gentlemen, and stay safe. And thank you.
Thank you.
Thank you, Judge. Thanks for having us. Bye-bye.
Bye-bye.